bringing you information based in fact and science concerning today's marijuana. I'm your host, Chris Wolf, and this is Perspectives. With us today is a subject matter expert from the National Marijuana Initiative, sharing their perspective on the influence that today's more potent forms of marijuana products are having, both in our society and in their field of expertise. Welcome, Dr. Libby Stuyt. As an addiction psychiatrist, is marijuana addicting?
Well, yes, in a word. Many people ask that question because the industry has really tried to tell people it's not. However, with the higher potency marijuana, the high THC, it has become extremely addictive. And we know that because there's a withdrawal syndrome associated with it. So if somebody is using it daily on a regular basis and they stop, they can experience some significant problems like anxiety, irritability, anger, which and a severe desire to use again.
Can marijuana actually cause psychosis and schizophrenia?
Yes, I believe it can. Right now, we're still in the stage of correlation versus causation. However, I think we're seeing a lot of research showing that there actually is a direct cause. So all addictive drugs can cause psychosis, but the one that has the highest conversion rate from psychotic symptoms to schizophrenia is marijuana. That's over alcohol, methamphetamines, cocaine. And so, yes, it definitely causes psychotic symptoms. Many people don't even know what that means. So when you're talking about psychosis, you're talking about an altered sense of reality, where people can hear voices that no one else hears, see things that no one else sees, be extremely paranoid, and have severe delusions where they believe the CIA has put implants into their brain and they're listening to them.
And how does marijuana affect the developing brain of an adolescent or teenager?
That's our biggest concern. Mainly because the time during puberty is one of the biggest growth times in the brain. So there's a lot of things happening. And the best thing that has come out of all this stuff with marijuana is our better understanding of the endocannabinoid system. And we now know that the endocannabinoid receptors actually play a big role in brain development. And so during puberty, we actually strengthen nerves by myelinating them, and then we actually start pruning them. So the brain decides what nerves we're going to keep and what nerves we're going to get rid of. And marijuana interferes with that significantly, because what we now understand is we have our own chemicals that we create in our brain, and one of them is called anandamide. It's very interesting that is a Sanskrit word for supreme joy or bliss. And that means this is our homeostatic system. It helps regulate us. It helps regulate our moods. And so if you put exogenous THC into the brain, it fits in that receptor perfectly, and it makes it where our own natural chemicals can't work. And so this is why we have a lot of problems with young people with cognition issues, IQ issues, executive functioning problems where they can't make good decisions because of the effect of THC on that developing brain.
And what exactly is cannabinoid hyperemesis syndrome?
All right, this is something that used to be thought to be very rare. However, it has been around for centuries. I even found a recording of it in something like 1080, which is an idiosyncratic reaction to marijuana. Marijuana is supposed to cause relief from nausea and vomiting. But what we're finding now is, especially with the high potency products making people use more regularly, we're seeing this idiosyncratic reaction where people get severe nausea, abdominal pain, and they're in so much distress that they're actually screaming and vomiting.
You're an absolutely wonderful guest. I thank you so much for being here. Please come back and join us again. And again, thank you so much. Thank you.
You're welcome.
To learn more facts about today's marijuana and its impacts, visit the National Marijuana Initiative's website at www.thenmi.org. Thank you for joining us for this episode of Perspectives.